Early care of your new baby.
For some parents, going home with your baby can feel overwhelming. For parents of multiples, going home with more than one baby can feel even more overwhelming. Your midwife, health visitor and the wider team are all here to help. After birth, you'll receive ongoing support as we help you adjust to life with your new baby.
We'll provide information on things like what to expect when you go home and when you will next be seen, cord care advice and nappy changing information, how to practice safe sleeping and information around your feeding choice, changes and growth you might see in your baby, and of course, who to contact if you have any concerns. The newborn physical examination. Within the first 72 hours of birth, you'll be offered a screening examination for your baby called the newborn physical examination. This is part of a national screening programme and is often done before you leave the hospital, but it can also be done at home by a specifically trained midwife or doctor. The aim of the examination is to identify any concerns early to ensure treatment is started. This will be explained to you beforehand and is primarily looking to ensure there are no problems with your baby's heart, eyes or hips, and to check that your baby's genitalia looks okay. They will have their heart listened to with a stethoscope, their eyes examined with an ophthalmoscope, and checks on their hips to ensure they are not dislocated. Some parts are a bit uncomfortable for your baby, but they won't cause any pain. And don't worry, it's quite rare to find anything that is a cause for concern. Your GP will offer to repeat the examination at your 6 to 8 week check. Support and routine checks after you go home. Most people go home from hospital within 24 to 48 hours of giving birth. After you've been discharged, your local community midwife will visit you at home on the first day. If you have any concerns before this visit, you can phone one of the emergency numbers provided. The maternity team will offer further visits on day 3, 5 and 10, and your health visitor will see you at home between day 10 and 14. On day 3, we may offer to weigh your baby and check for jaundice. If we think your baby might have jaundice, we'll offer to check the levels of a substance called bilirubin, which causes jaundice. We can easily do this at home for you with a sensor machine. This will give us an indication as to whether the baby may need any treatment. On day 5, we may offer to weigh your baby and perform the newborn blood spot, which is more commonly known as the heel prick test and is offered to all babies in the UK. This involves pricking your baby's heel to obtain a blood sample, which is then put onto a card and sent away for testing. This will be discussed with you at least 24 hours before for you to consider whether you want to have the test done. It currently screens for 9 disorders: sickle cell disease, cystic fibrosis, congenital hypothyroidism, and 6 different inherited metabolic disorders. All of these conditions are genetic, so cannot be cured, but early diagnosis and treatment can improve your baby's health and prevent severe disability or even death.
We appreciate that no two families are the same. To personalise your postnatal care, extra visits can be arranged to support you and your baby's well-being.
Cord care advice.
Caring for your baby's cord is very straightforward. Whilst you wait for it to fall off, all you need to do is to keep it clean and dry. There's no need to apply any creams, it will heal itself. Although it may look uncomfortable, there aren't any nerves in the cord, so it won't cause any discomfort when you clean it. If the area looks red or has an unusual smell, please get in contact for advice.
Nappy changing information. During each visit or appointment, you will be asked about the content of your baby's nappies. In the first 3 days, your baby's stools will be mostly meconium, which is black and sticky in consistency. We sometimes call this the early poo. Remember, you are still establishing feeding at this point, so there will be fewer wet and dirty nappies than you might expect. Between days 3 to 5, the stools will begin to change colour as the first feeds make their way through the baby's digestive system. They often turn green in this stage, and you will notice the amount of wet nappies start to increase. You would expect approximately 2 dirty nappies and 5 wet nappies in a 24-hour period. Eventually, the stools will turn to a mustard yellow colour. Please be aware that breast milk contains a natural laxative, which means your baby may have a dirty nappy with almost every feed, and this is completely normal. Having regular wet and dirty nappies is a good indication that your baby is feeding well and receiving enough milk. Changes to look out for. As your baby gets used to life outside of your womb, you may notice some changes. Here are some of the things you can be looking out for. Dry skin. This is normal, and there is no need to use any creams or oils. These can upset the good bacteria found on your baby's skin that protect them from infections. Skin rashes. Most rashes are normal, but please seek help if you're concerned. Sticky eyes. This is very common, as newborns do not produce tears effectively. This usually clears up with regular cleaning. Your healthcare professional can explain how to safely clean your baby's eyes. If you're breastfeeding, the eye can be cleaned with breast milk, as the antibodies in the milk will help reduce the risk of infection. The big sleep questions answered.
All new parents want to keep their babies safe. Understanding safe sleeping will help to reduce the risk of cot death, also known as sudden infant death syndrome. There are many sleep aids like nests and pillows, but guidance tells us these are not safe to use. If you're unsure about something that's been recommended to you, please speak with your midwife or health visitor.
Fundamentals of safe sleeping. There are 3 main principles to safe sleeping: sleeping position, surroundings, and temperature. Position your baby on their back to sleep. Their feet should be at the foot of the cot so they cannot wriggle down under the covers and overheat. Make sure their sleeping space is clear of toys and bumpers. The room temperature should be kept between 16 and 20 degrees where possible. In hotter months, lighter bedding is recommended. You can use Holy baby blankets to keep them cool. In colder months, no hats, duvets or cot bumpers should be used indoors, especially whilst your baby is sleeping, as this can prevent the air from circulating around them. It's also important to think about where your baby's cot is positioned, not next to any extremes of temperature such as an open window or radiator. Finally, keeping your baby smoke-free before and after birth is highly recommended.
We ask you to put your baby to sleep in their own safe sleep space, such as a cot or Moses basket. Some parents choose to sleep with their baby, especially when breastfeeding. This is called co-sleeping. There are ways you can do this safely to minimise any risks.
How to practice safe co-sleeping. Keep your bed clear of pets and other children. Keep pillows and adult bedding away from your baby. Ensure they cannot get trapped in or fall out of the bed. Never sleep with your baby on a sofa or armchair. This dramatically increases the chance of sudden infant death syndrome. If you feel you may fall asleep with your baby, please do this in your bed safely. Bed sharing is not recommended if anyone in the bed has recently drunk alcohol, smokes, or is on any medication that makes them sleepy. Bed sharing is not advised if your baby was born prematurely or weighed less than 2.5 kilograms at birth. All of this information can be accessed via the Lullaby Trust.
As you and your baby get to know each other, you'll find out what works for you. The whole team is here to help and support you and your family. If you ever have any concerns, please contact your local maternity unit on the numbers provided or call NHS 111 for advice.
To find out more, visit sneewellbeing.org.uk/maternity.